We know that when people eat really good, healthy food, their health outcomes are better. Our healthcare system historically has not focused on the role that nutrition can play in someone's overall health and well-being. And the idea of food as medicine is that we can make a connection between nutrition and someone's diet and their overall health and well-being.
So community servings, we provide meals for people that are in the community that are dealing with critical and chronic illnesses.
Medically tailored meals are meals that are provided for clients that have a range of medical issues that need specific diets. So that looks like people with diabetes, we try and cater meals towards their diabetic needs, as well as people with renal failure, our mothers as well as children.
So I have the unique perspective in that I started volunteering for community servings before we'd ever delivered our first meal. So we're talking 34 years ago, 1990, and it's the height of the AIDS epidemic. People are dying, there are no medicines, and in our case, people are wasting away from malnutrition, what's called AIDS wasting syndrome. But they don't know they have the illness, and they don't know that they might be able to improve their outcomes if they ate a heartier diet. There is no one in New England that does what we do at the scale that we do it. We all know intuitively that eating well is important to us on a spiritual level, on a health level, on an energy level. But surprisingly, community servings set out to actually prove that, something that is so intuitive. But through the partnership we've had with leading researchers, we've been able to prove the cost savings and the health outcomes, the improvements in health outcomes that have come through providing medically tailored meals.
Food as medicine is the provision of food resources to prevent, manage, or treat specific illnesses. Medically tailored meals, or MTM, is a specific food as medicine intervention. It benefits patients who live with severe, chronic, or complex health needs and who experience activities of daily living limitations. Medically tailored meals are made from high-quality ingredients and fully prepared. They are designed by a registered dietitian nutritionist based on the individual's diagnosis and dietary needs, and they are home delivered, chilled or frozen, once a week.
So the Food as Medicine Coalition, also known as FIMIC, is a coalition of agencies across the United States that are collaborating to improve access to food as medicine interventions, like medically tailored meals. These agencies are nonprofit, community-based organizations with deep, deep roots in the communities they serve. Community Servings is one of these agencies. A recent study actually estimated that if we provided medically tailored meals to everyone who qualified for them in Medicaid, Medicare, and private insurance, we would actually avert 1.6 million hospitalizations and save $13.6 billion in healthcare spending each year.
Community Servings has healthcare contracts with over 20 healthcare partners in Massachusetts and Rhode Island. We partner with lots of different organizations, hospitals, Medicaid ACOs, community health centers, and some other innovative providers in this space. When we start talking to a partner, we really want to understand what is their goal in starting a medically tailored meal partnership. Are they looking to reduce A1C in a diabetic population? Are they looking to prevent readmissions, decrease total cost of care? And when we can come together and understand what their goal is, then we can put together a partnership that will make the most sense.
Community Servings hosts a little over 100 volunteers every single day. And those volunteers are integral to our success operationally. And we found that the volunteer experience is really enriched when we include them in everything that we do. So we spend a lot of time vetting and working with local vendors who are raising food the right way. Our goal is to provide a memorable culinary experience for people who may not have a lot of other really positive things going on in their life right now. So for us, sourcing is where it all starts, and it is a huge component of how we show that our clients are cared for and how we seek to serve their health needs.
Our meats are from local farms, and that's quality. You know, it's not mass produced. So you know they're actually putting their hands on it and making sure it's done the right way.
What really sticks out to me is inclusion. I think that when someone's diagnosed with, renal failure, diabetes, I think that you sometimes think, well, there goes all of the food I love. And here, we say, all right, you're under a strict diet, but we would like to provide you with food that you enjoy, but also will sustain you. And I think that when people learn about community servings, and especially clients, I think that they realize there are so many options to what you can eat, and you don't have to focus so much on what you can't eat, because that can be a very large list. So I think inclusion is a huge part of community servings.
So the community servings, we have 2 facilities. One is in Boston. Primarily our delivery zone in Boston is north of the city in Metro Boston. As west is Worcester, which is about 60 miles away. And then our second facility, which is in Mansfield. Through there, we are able to deliver through all of southeastern Massachusetts, the Cape, all of Rhode Island. So in Mansfield, at our satellite facility, we are packaging meals, delivering meals, and it's the sort of the hub of where we ship all of our meals to our clients throughout Massachusetts and Rhode Island. One of the areas of the work that I truly enjoy is being able to connect with our clients. It's great to produce the meals, but being able to deliver to them and see them and making sure that they're getting these meals that they need. Such a fantastic opportunity to stay connected to the mission. The drivers build a bond with the clients, and the drivers look forward to seeing those clients and making sure that they're doing well. And it's really one of the most rewarding parts of the work that we get to see each day.
To know that I'm going to have a good meal, no matter what's happening with different systems of my body, is a reassurance and a comfort. And while I can stock up on food, it's awfully processed and it's not very healthy. And Community Servants provides the healthy, delicious meal for me. And I'm so grateful. As a result, I've lost about 35 pounds. My insulin is down about 33%. I have more energy. It's been really profound.